Alright, so universal health coverage to me means that everybody has insurance regardless of their income level or their socioeconomic status.
Universal health coverage to me means basically everyone gets health care. It's equally distributed, and so like no matter your income or no matter your class, you're basically entitled to the same health care as any other person.
Just that people all over the world get health coverage for like an affordable price. Everyone's covered.
The head of the World Health Organization called it the single most powerful concept that public health has to offer. A solution that can stop the world's biggest killers, from HIV, TB, and malaria to cancer and heart disease.
I guess nobody gets left behind really. Like a lot of people are stuck without. There's like health safety net and stuff like that, but it's not really good coverage. So with this, everybody's kind of guaranteed good health coverage.
I think ultimately, right, you're going to have more people that are going to be cared for. But other than that, you're going to have people coming to the table with issues that they may not feel comfortable talking about because they're not covered by an insurance policy or something like that. Potentially, you are also going to see also an economic shift because you're basically, when people need care, they're going to have people who care for them, right? And so that's going to provide for more jobs. There's going to be more of a demand for that type of work, and so I guess in the long run you're going to have more people taken care of, but then at the same time you're going to also be stimulating the economy in some sort of way. So a lot of potential.
Just basically that everyone's going to be covered, and even if they can't afford it, it's just going to be like everyone's going to have the same coverage.
For many, universal health coverage is literally a life or death issue. Individuals without health coverage facing the prospect of untreated sickness and premature death for themselves and their children. Universal health coverage can also mean the difference between a financial survival and destitution. The beneficial effect of increasing coverage with needed health services of good quality is well documented. One recent study of statistical trends from 153 countries published in The Lancet found that broader health coverage generally leads to better access to necessary care and improved population health, with the largest gains accruing to poorer people.
I would say co-pays. A lot of people go in, they get a service, and then they come out with this huge bill that they kind of, so it's like a co-pay but comes out of pocket.
I think that may be a mix of some type of a co-payment. I think that maybe the insurance policy covers a certain amount, but then people are also forced to pay out of pocket a certain amount. So I probably think that's the most common. I think it's really rare for people to get fully covered medications and prescriptions. And I also think that it's not as common as you think that people pay totally full in payment. So I think a combination of both, being covered by, to a certain extent by insurance policies, but then also out of pocket.
Out of pocket?
One of the most common forms of payment for health is direct out-of-pocket payment for medicines and health services at the time of need, and it's the poorer countries that rely on it most. An estimated 150 million people suffer financially crippling health payments because of this annually, while 100 million people are pushed below the poverty line simply because they need to use the health services but must pay out of pocket for them. The problem is by no means limited to developing countries, however, as evidenced by the United States, where it is estimated that over half of the personal bankruptcies are due to expenses for medical care. Every year, almost 1 in 5 people in low and middle income countries are pushed further into poverty paying for health. Imagine choosing between buying medicine and feeding your family, staying healthy, or staying out of bankruptcy.
Absolutely, yeah. we have to uphold this reputation of being a world superpower, and I think to add to that, we should have the best healthcare in the world as well.
So yeah, I think that it definitely has its benefits. It has more benefits than drawbacks, I think, and I think also that contrary to the belief in that people activating a kind of universal healthcare system in the United States, it isn't really as progressive as people may seem, but I think that it is. I think that it can help a huge amount of people, no matter what their income level is, no matter what class they're in, or no matter what marginalized group they belong to. I feel like it definitely has its benefits, and it should be implemented in the United States.
Definitely. Everyone's going to be covered, and there's not going to be no man will be left behind.
So, let's give everybody a chance and give them the health services they deserve. Let's help them eliminate their poverty and their unnecessary medical bills.